Hello, everybody, and welcome to our session today. This is the first of a series of our webinars and our inaugural session, and we want to welcome you and thank you for supporting us today. These sessions, this series of webinars that's going to be holding throughout this month are actually sponsored by the National Lottery and the government. And we are doing these webinars to support people with kidney disease and transplant patients and their families and anyone else who is interested in learning about kidney disease. So without further ado, I want to introduce our expert who is going to be speaking this morning. His name is Dr. Chrid Agbo. He's a consultant nephrologist, and he is the expert on everything kidney. So without further ado, I'll put him on screen and he's going to start talking to you. Now, if you have any questions, please put your questions in the chat box. And once we're ready, we are going to put them on screen for the consultant to read them and explain, answer your question. Now, I would ask you also, if you can see us, if you can hear us, I'd like you to press that like button, or if you are on YouTube, can you just leave a message and say yes, and we would be watching from behind, waiting to put your questions on screen. Okay, so without further ado, let me introduce Dr. Chrid Agbo. Doctor, you're welcome.
Thank you very much, Ilaria. It's nice to be part of this program. Firstly, we're just going to look at kidneys. We're here talking about kidneys. So one of the things we're going to be looking at, the organs that people most often take for granted, and that's the kidneys. So we're going to look broadly. Firstly, we talk about looking after our health, and then we'll go specifically to the kidneys. I'm not going to go into nitty-gritties of what kidneys are and what the different kind of kidney diseases are, but for us, we talk about what the kidney does for us as human beings, how to look after our kidneys, and what happens when we develop problem with our kidneys. So we're going to look at through this short talk, we're looking at the background, the misconception within our people in terms of how they handle health, how we can prevent kidney disease and other health-related diseases, early detection, how to handle diagnosis. If you are told that you have kidney problem, how to respond to the healthy life. Then specifically talk about the kidneys, looking after your kidney, and we talk about organ donation, which is very key to what we're doing today. So Black individuals develop high blood pressure early in life compared to our Caucasian colleagues. This may increase the risk for experiencing a stroke at a younger age compared to our white colleagues or counterparts. And research has shown that various ethnicities showed Blacks that had the greatest decline in cardiovascular disease. So what it means that as a Black person, you have an increased risk of developing cardiovascular disease more than your white counterpart or Asian counterpart. And a poorer outcome in some disease conditions due at times to late presentation and attitude, increasing mortality among young Black people. So what happens most times, we do have a lot of poorer outcome with most disease conditions occurring within Black community. But one of the reasons being that there's always this issue with late presentation. We do not take our health very seriously. And what that happens is that we get dictated late. And once you have late presentation, the outcome gets poorer. So one of the things we encourage people to do to make sure that we get this early detected and we'll be able to manage the condition very effectively so that you can actually get a good outcome. So that's one of the areas that are actually been affecting the poorer outcome among the Black community in most of the disease conditions we experience. The peculiarity with us as Blacks, we have a lot of misconceptions. Some people were so superstitious, disputing science with some beliefs. A lot of time we think we just want to excuse every particular disease to a problem. So it's, it was after I visited ABC that I started feeling this way. So we always try to associate a particular symptom to something. So, and that affects us because we do not take things very seriously and we don't present to healthcare professionals to get assessed or checked. So we carry on until things get very badly. And the spiritual cause to every disease, cancer spirit, back to sender approach, binding and casting, a lot of them were quite religious. I'm a Christian, no doubt about that, but I've seen that even in the Christian community, we get so religious that even when people are told that I've been in clinic, I tell the patient that, oh, you've got kidney disease, say, God forbid. And those are things that I felt that maybe because she knew that I'm a black Nigerian, because if you are talking to someone that doesn't even know God, you can't be saying things like that. But our approach is usually of denial. We don't accept that, oh, it's going to come to us. We just feel that this disease is not our portion, but we are human beings, we're individuals, and everybody, everywhere, you have a particular time you have to have one disease or the other. That doesn't mean that something else has happened to you. So those are some of the things that gives us a bad footing in terms of managing our health and also the outcome with our bad condition. And of course, we have this dangerous information from various sources. This is the era of social media. People are talking a lot, sending all sorts of erroneous things on Facebook, WhatsApp group, talking about, people are standing and forwarding messages about kidneys that they do not know anything about. So, and these people believe those things more than they believe actually what the doctors tell them. So that affects our people a lot, and we have the wrong attitudes. Same with even the black community here in the UK. I find out that there's no much difference with black community here in the UK compared to those ones back in Nigeria or in the United States, because the way their approach to health is just very appalling. Sometimes you tell people, oh, have you actually been to see your doctor? Say, no, I don't need a doctor. And this person is probably in his 50s. And you say, you mean you've not been to your GP? Say, well, I don't feel unwell. But that's not how it should be. We are meant to be checking our health because there's some of the conditions you don't really know that you have got them until they've got very badly. So it is important that we change our attitude. One of those things is just our wrong attitude. And we indulge a lot in self-medication, traditional practice, rather than things that have been prescribed. A lot of time people hand over, so, oh, I used this when I had this condition, use it, try it. And they are more than happy to do those. I've seen people that here in the UK, they went to someone's kitchen and found that they have these bottles of herbs. I said, where did you get them from? Say, they got it from Nigeria. So people are still consuming things like that in the country here. And those are things that impact badly on your kidneys and other organs. So those are some of the things that we are doing as a community that's really impacting on our health. The prevention is better than cure all time in all cases. You can't overemphasize this. Preventing any condition is far better than curing it, because once you've been able to prevent it, there won't be any need to even get into looking for the cure. So it's very important. Early detection and treatment improves the outcome. We are working on telling people that make sure that you get yourself checked at all time. Once the condition is detected early, one of the things that especially we try to do is to make sure that we slow down the progression of the disease, make sure that we control it very effectively, and the outcome will always be very good. So it's important that we have that early detection. Addressing the cardiovascular risk remains the main target in order to improve our health. However, as we get older, we have a higher risk of developing diabetes, high blood pressure, cardiovascular disease, stroke, and kidney disease. So those are some of the things that as one gets older, the chances of that happening becomes more. So it's important that we look into our health very carefully. And of course, for the NHS, we have a NHS Health Check, which is designed to detect any form of disease in an individual at a different age group. Especially once you get turned 40, your GP will have written you to go for an annual check, and thereafter you can have a regular check with your GP. So the NHS Health Check, over time, we find out that between people at the age of 40 and 75, it's done yearly, and some of them 5 yearly, depending on if there was anything then identified or not. And then we found out that 27 checks were able to detect one blood pressure. So out of 27 people that went for a routine check, one person was detected to have high blood pressure. 110 checks that was done, one person was able to detect that they had diabetes. And 265 checks that was done one person was diagnosed to have kidney disease. So that tells you that it's even very important. Even though we don't feel anything about our health, we just feel that we're okay. It's important you have a regular check, especially when you approach the age of 40. But of course, if you are younger than 40 and you have any medical problem, make sure you see a healthcare doctor. Then we'll look at the kidneys. The kidneys, because we are here talking about the kidney, so we're just going to go through the kidneys, what the kidney do for you, why the kidney fails to work properly, how to look after your kidney. So what does the kidney do for you? The kidneys are one of the organs in the body that's usually not taken into consideration because they're just sitting at the back doing their work silently. But of course, I can tell you that different parts of the body will have an impact if the kidney starts failing to work. So some of the function of the kidney: excretion of the waste products, electrolytes and fluid, blood pressure control, some of the substances in the body, calcium and vitamin D, and they also regulate the acid-base balance in our body, and it helps the body to generate some blood cells. So those are just basically some of the most specific things that the kidney does. And we look at this is just a graph showing the prevalence of kidney disease in the population. You can see that there's quite a significant is quite significant, the increase in the kidney disease over time. So those are some of the things that we're looking at minimizing the prevalence. So why the kidney fails to work properly? So we have a different disease condition that once those things are poorly controlled, they tend to affect the kidney because of the way the function of the kidneys is very intricate, because it does handle a lot of things in the body. Apart from excreting the waste, it also helps in the balancing some of the metabolism in the body. So some organs cannot work effectively without the kidney. So kidney kind of supports the body generally. So there's some symptoms when they are failing, they tend to impact on the kidney. So if you have one has got diabetes, the tendency is about 40% of the kidney disease will come from that, especially among the Black community. Then also blood pressure. That's another area that if you have a high blood pressure, hypertension, it is very important that you make sure that the hypertension is well under control. If your hypertension is not well under control, over time it's going to impact on your kidneys, and once it passes on your kidney, it gets to the level that we cannot actually reverse the impact it has done on your kidney, and your kidney will start failing. So it's important that if you've been diagnosed to have high blood pressure, take it very seriously. Make sure you're taking your medication, living a healthy lifestyle, and making sure your blood pressure is well under control at all times. Even if your blood pressure is normal, don't stop taking your medication. We're going to come to that. The other condition that can lead to kidney problem, virtually everything that can, 1001 things that can cause kidney problem. When any system in the body is not working well, the chances that it's going to impact on the kidney. If someone has got a heart problem, the heart is not functioning well, it will impact on the kidney, because the heart delivers a certain percentage of its function to the kidney to handle. So those are some of the things that happens. And also, if we are unwell for different reasons, it will invariably impact on the kidney. So there's so many things that can happen just by one being unwell that could impact on the kidney. Then of course we have the genetic factors. There's some disease conditions that are genetically inclined, and those ones, they just comes and they affect the kidneys. There are some drugs that are not very good for the kidneys, and a lot of time we discourage people for taking over-the-counter medication, traditional herbs. Some of those medications are quite toxic to the kidneys, and once they affect the kidneys, the function start failing. So it's very important. One of the commonest cause of that is what we call non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, naproxen. Those group of medication, if you're taking it over a long period of time, it will impact on your kidney and it will start affecting the function. So there's a whole lot of other medication that will also affect your kidney. So that's why it's important not to self-medicate. If you have any problem, discuss with your doctor or your pharmacist so that you make sure they're giving you the right medication that will not affect your kidneys. The list is endless, but what I need to tell you here is that there's what we call acute kidney injury, and these are the ones that can actually happen and we treat it and they resolve. So when someone has been unwell for any other reason, if you've got infection, the chances of you having kidney problem is higher because your kidney starts not working well, if you've not eaten and drinking well, if you're kind of dehydrated for any reason, maybe you're having diarrhea or vomiting, those are things that could easily impact on your kidney function. And once that is not addressed very properly, it could actually lead to further decline in your kidney function. These ones are things that we can easily resolve, and your kidney goes back to normal. So those are the ones we call acute kidney injury. So when those happen, we can easily treat the cause, and then the patient will get back to normal renal function. But it's important for us to make sure that those things that predispose us to having that is not there. If people have had different medical conditions, that will also increase their risk of having kidney diseases. So someone that's got diabetes, hypertension, has got cancer, has got heart failure, once you have any of the liver problem, it increases your risk of developing kidney disease. And the older we get, our kidneys start working lesser. So elderly group of people, they also have problem with their kidneys because the kidneys are now not working as much as they were working earlier on in their lifetime. How does the kidney problem present? I've already talked about the acute kidney injuries, and then we also talked about the chronic kidney injury. So the presentation could be acutely. So acute kidney injuries are usually those ones that come with some other problem that's causing the kidney to fail at that point in time. And once that cause is identified and treated, the kidneys return back to normal. So the kidney dysfunction is usually happening within a period of couple of days or weeks, or maybe a week before. So someone has got a normal kidney function, has diarrhea and vomiting, get to the GP, check the blood, and find out the kidney function has got badly. It might just be that the patient has lost a huge amount of fluid and is impacted on the kidneys. We treat that resolves, and the kidney function goes back to normal. So there's so many things that could cause acute presentation of kidney dysfunction, and those ones, the good thing about them that we can easily treat the causes, and then the patient will get a normal renal function back. But then we have a certain group of people with chronic kidney disease. These are ones that are associated mostly with other conditions like diabetes, hypertension, liver disease, heart disease. So those ones, because this other condition is a long-standing condition, the impact on the kidney over a period of time, and they start having different gradual decline in their renal function. It might be just over a period of years, could be over a period of months, but it's not a rapid decline. And that's why we say that it's important that when you have any of these conditions that I mentioned earlier on, hypertension, diabetes, liver dysfunction, heart failure, make sure that you look after your kidney well, because those ones are impacting. There's an interlink between those systems and the kidney. So once they're not working well, the kidney will start getting the impact on that. So that's one of the things that we look into. And the thing that is deceptive about kidney problem is that most often than not, they're not symptomatic. So a lot of time you look at people and say, oh, you've got this, your kidneys are functioning at 35%. You say, oh, well, I don't feel anything. So, and because of that, people can be misguided because you feel that, okay, I'm not feeling anything, and they're telling me my kidneys are not working well. So that's one of the major things about managing people with kidney problem, like other conditions like heart problem. Those ones will, in early onset, they will start developing the symptom. But for kidneys, especially, majority of them will be asymptomatic. A lot of time we'll discover them on routine check. People have gone for insurance, done their urine testing, and it was just found that they have protein in their urine. And that will be the beginning of their journey into kidney problem. Some will have actually been checked. Okay, they went to their GP to have a routine check their blood pressure. The blood pressure was high. They did a blood test and found that their kidneys are not working well. So majority of the patients we see that they refer to us by GPs or we see in the clinic are usually asymptomatic. They just present because they've had one blood test done. Maybe they were going for surgery and they did some blood tests just for assessment, pre-assessment, and they discovered that the kidneys are not working well. So those are the ways we pick up people with kidney problem. And because of that, it's important that we now have to make sure that we have a regular check on our health. So just to make sure that your kidneys are working well, because you might think, oh, well, I'm not feeling anything, but your kidneys are actually on a decline. So it's important because they are not symptomatic most often. So we need to be careful. And symptom varies on the causes. So depending on what the causes are, there are some that are actually have a specific symptoms, and those are just dependent on the causes. So we look out for those ones. But overall, majority of the patients with kidney problem will likely going to be presenting asymptomatically until the kidney function has gone very badly, unless there's any cause to that, which of course we identify the cause and find out the cause of the kidney dysfunction and treat that. So those are some of the things about the presentation. So I'm not going to go into details about the different symptoms, because if I mention that, it's just going to mislead people. People think that everything they have is kidney. So it's important that when you feel unwell, regardless of the symptoms, seek the assistant advice of a doctor. And of course, even if you don't feel unwell, if you just from time to time get checked once in a year, get your blood test done, make sure you know what your kidney function are doing. And also do urine dipstick, because those are times when we do urine tests, your kidney function might be normal, but your kidney have already started leaking protein in the urine, which is early stages of some serious kidney problem. So it is important that we look into that very carefully. Treatment choices in kidney failure. So if of course people that have got chronic kidney disease, we have the stages: stage 1, stage 2, stage 3, stage 4, stage 5. So if you're progressing to the level, and most often than not, when we see people presenting with chronic kidney disease, our target as specialists is actually to make sure that we slow the progression from, if the patient is coming to me in the clinic with chronic kidney disease stage 3, my target will be to make sure it doesn't progress to stage 4. So those are the two. One, to slow down the progression of the kidney disease. That is, of course, if we're able to identify the causes and all that, we'll be able to treat. But those ones that are already irreversible, they're going to be progressing. So that's what we call them chronic, because they're not likely going to get back to normal renal function. So what it means that they're going to get progressively worse over time. And because they're going to get progressively worse over time, it's the specialist's responsibility to make sure that this progression is very slow. So if somebody has come to me with chronic kidney disease stage 2, I want that to remain stage 2 for as long as possible, and that is our target. So we don't want a rapid the progression of the chronic kidney disease from stage 2 to stage 5. And of course, if you get to stage 5, we're looking at the time where you will now be requiring some support to be alive. So we don't want to get to that level. What we want to do is actually to keep people as far from the end stage renal disease as possible. So that's why early detection of this chronic kidney disease is very, very important. So if one has eventually come with chronic kidney disease and it's been identified, what do we do? Most often than not, we have different treatment options. So if your kidney has got to the level, at this point, the person will start getting different kind of symptoms. So you already know the kind of symptoms: getting very tired, feeling sick, not eating and drinking well, lethargy, general deterioration. So at that point, the kidneys are no longer working well. And we are talking about when the kidney function, the percentage is getting to below 15, 10, depending on whether you're diabetic or not. And when it gets to that stage, what we're now looking at is we've gotten to a stage of point of no return. At that point, we cannot do anything for the kidneys. So the option we have at this point is now, how are we going to treat? What are the treatment options? And that's what we talk about, the renal replacement therapy. At this stage, we call end-stage renal disease or end-stage renal failure. What it means that if the patient is not on any form of renal replacement, the patient is not likely going to survive. So what it means that the patient cannot be maintained alive without some form of replacement therapy. So, and we have different options. Of course, we have the dialysis, which there are different form of dialysis. We have the hemodialysis, which is we can do. There's some we do at home. There's one we do also in the hospital. You come 3 times a week. We are put in a machine, and what the machine does is just will take the blood out of your system, pass it through the machine. It removes all the waste and take it back. So you do that for 3 to 4 hours in a machine 3 times a week. That's for hospitality. And this is just to help part of the function of the kidney. And because the kidney function is not just for excretion of waste products, so we're still going to be putting some patients on different because we talked earlier on that the kidneys also look after calcium and vitamin D production and all that. So a lot of time we find out that those are deficient. So we put them on different kind of medication. The kidney cell help the body to produce blood cells, and because those blood cells are generated in the kidneys, if the kidneys are not working well, the person is going to be anemic. So we're going to put them on different kind of therapy, iron injection, also give them some vitamin to help the body to build up the blood level. So those are some of the things we do for that. Then we have the peritoneal dialysis, which those ones are the ones that we go through the tummy. You don't need to go through the machine. That can be done at home. We also have the automated peritoneal dialysis, where you just pack all the fluid in the machine and just you can lie down, and then that goes on over a period of time up to 8 to 10 hours overnight, and if you exchange. So those are just some of the treatment options. Then the gold standard, of course, is the transplant, kidney transplant. So kidney transplant, what it means that we get a kidney from a donor, which could be a live donor or a diseased donor. We have in the UK, we have a national pool of a donor. So we get a donor, then we put that kidney, mostly one kidney, put it into the recipient. And most often than not, with the patient is going to be on immunosuppression, just to make sure that, because it's a foreign, this kidney that's going into another person is foreign to that body. So we use immunosuppression. So the patient will still be on immunosuppressive therapy. So it is either way. Once you have kidney problem, you have to be on different kind of medication for life. So even if you have a transplant, you're still going to be maintained on some key transplant rejection medication, which if you don't take them, the kidney will start failing. So the good thing about transplant, that once you've had a kidney transplant, your kidney function goes back to normal, so you can live a normal life and all that, which is that's the gold standard in managing people with end-stage renal disease. So the prevention, like we said earlier on, is very, very important. And some of the kidney problems can be avoided. Some of the things that will lead to us getting to the level that one requires renal replacement therapy can easily be avoided. So if you look into our health very carefully, we should be able to actually prevent some of this happening. So how to keep the kidneys healthy? Periodic health check with GP. So we've talked about that. Make sure you get yourself regularly checked with your doctor. Check your BP if you are at risk or not. Check your prostate if you are above the age of 50. We've had people with lower than 50 that develop prostate problems. So make sure that you get your prostate checked. Try to avoid excessive weight, diabetes, high blood pressure. Make sure you have a good diet and exercise regularly. Good diabetic and blood pressure control. Be compliant with your medication. People that with chronic kidney disease, or people that have poorly controlled diabetes or poorly controlled hypertension, I can tell you with confidence that a lot of time they will end up developing kidney disease. So it is important that if you're diabetic, please look after yourself. Don't let it get to the level that the control is very erratic. If you have hypertension, please look after yourself. Make sure your blood pressure is well under control, because if these ones are poorly controlled, what it will lead to is decline. It will affect your kidney, and once we get to that level, we start battling with the major problem, which is the chronic kidney disease. Seek medical advice if you notice any symptoms. Please, if you notice any symptoms, seek medical advice. And one of the things I just need to mention here is that if for any reason if you've seen your doctor and they say you have kidney problem, don't panic, just remain calm. Try to find out more about what exactly is the problem, and make sure that when you're seeing a specialist, listen very carefully to what he's saying. If you have any question, ask the specialist, seek advice from the specialist. Don't go back and start getting information from people that do not know what that disease condition is. So information is important, information is power, but getting the right information is the key. So don't put yourself in a situation where you're sitting in front of a specialist and he's telling you about, oh, this is what your kidneys are doing, and you can't be bothered, you don't want to engage. Make sure you engage with your health. It is very important. Remain positive. Most often than not, when we have problem with kidneys and all that, we always have a way of dealing with them. So that is not the end of the road. If you have a kidney problem, be positive, be focused, be determined. Make sure you work with your specialist. Whatever they tell you to do, please comply. If you're not sure, make sure you get a clarification from the doctor. Most often than not, we spend a lot of time to explain to our patients what the expectations are, what the prognosis are. So we want you to work with your doctors, your specialists once you've been confirmed to have a kidney problem. And if you have any questions, any clarification, always get your GP for clarification.